everyone.
Hi, everybody.
Here we go again.
Yes.
I'm sorry about that picture, Chrissy. That one, really? That made me dizzy looking at it, I can tell you. Thank you. You always do a great job with that. So tonight we're going to touch on dizziness, which is not an easy or a light subject at all. But since we're going in a cephalocaudal, that one was for Chrissy, we thought dizziness would be a good one. Someone sent in a suggestion to do ringing in the ears or tinnitus, however you want to say it. And we're going to talk about that on Friday.
Oh, that's a good one.
So what is dizziness? Dizziness, almost everyone has had feelings of unsteadiness or a whirling sensation in their heads at some point in time in their lives. But it's usually chalked up to, they call it dizziness. It is a broad term that can mean different things to different people. It's a common complaint, but it can be serious at some points in time. Dizziness has no specific medical meaning at all, but there are 4 common conditions that can be considered types of dizziness. The first one is vertigo. Okay? Now you've all heard that term. That's the feeling of motion when there really isn't any motion, such as you're spinning around or your environment is spinning around. Think about as a child when you would spin around, and then you would stop abruptly. That's the feeling of vertigo. Okay? But when this happens in the normal course of living, it signals a problem with the inner ear, right? That's the body's balance system. About half of all dizziness complaints are vertigo. Susie's holding my cue cards and she's killing me.
I'm dizzy. I'm really dizzy right now.
Lightheadedness is the feeling that you are about to faint, okay? It's commonly felt by standing up too quickly or if you're breathing deeply enough times to produce that sensation. Disequilibrium is another one, okay? And that's a problem with walking. People with disequilibrium feel unsteady on their feet. They feel like they are going to fall. Anxiety. People who are scared, worried, depressed, or afraid of open spaces may also use the term dizzy to mean frightened, depressed, or anxious. Frequently, dizziness sufferers may complain of one or more type of dizziness. For instance, having vertigo may also make them anxious. Makes sense, doesn't it?
Yes.
Dizziness can be a one-time event or it can be a chronic, long-lasting problem. Nearly everyone who gets dizzy, however, gets better. Okay, so just remember that. Most people who have dizziness do indeed get better. So what causes dizziness? The first thing is infection. Some infections can cause dizziness. Certainly viral infections, because it can get into that inner ear and it can cause you some fluid in the ear, and that causes you to be dizzy or lose your disequilibrium, right? Also, positional vertigo, and this is the one, Susie, you were asking me about when you said, what about those crystals in the ear?
Yes.
So if you move too quickly, you go from a laying position to a standing position. It can be blood pressure related, but it also can be that there's some crystals in the ear and they get knocked off. When those crystals get knocked off, you can actually go, certain doctors do this maneuver. And when they do that maneuver on your head and neck, 80% of the time, if they do it correctly, they can put those crystals back in place and it stops that vertigo. It may not be exactly at that moment that it stops it, but relatively quickly after. Meniere's disease is another one that causes dizziness, and this is a disorder characterized by long-lasting episodes of severe vertigo. We have a ton of that in our family, and it's usually the women, more common in women, and we always say that we have a bunch of dizzy dames in the family. But it's always nice to know that when you go to your healthcare provider. They want to know, look, is this something new for you? Is this a family history? So pay attention to that and ask in your family. Another cause of dizziness that is less well known is a syndrome called Dandy's syndrome. And that's a feeling where you feel like everything is bouncing up and down. It can happen to people who are on a certain antibiotic, not a common antibiotic, but a certain antibiotic that's toxic to the ear. And less common forms of dizziness are the more tragic ones, and those happen to be stroke or tumors. Everybody always thinks that when they have episodes of dizziness. Thankfully, it's less common than all of the other things that we just talked about. Lightheadedness is usually caused by something surrounding circumstances impairing the blood flow to the brain when a person is standing up. We have to blame this on our ancestors who learned to walk upright. Putting our brain above our heart caused this problem. It's a challenge for the heart to keep the brain supplied with blood. So think about it, okay? Disequilibrium can be caused by a kind of arthritis in the neck, which is called cervical spondylosis, which puts pressure on the spinal cord of the neck and causes dizziness. Parkinson's disease, or any of those diseases where people are stooped over like this all the time. Again, think about it, okay? That's a natural cause for dizziness or lightheadedness. Disorders involving part of the brain called the cerebellum. The cerebellum is the part of the brain that's responsible for our balance and coordination. There's also diseases of diabetes, okay, that can lead to a loss of sensation in the legs. That can also cause these symptoms. And the last one, of course, is the anxiety, okay? Again, people feel unsteady or they just don't feel right in their world. And a lot of times it's from anxiety. That just gives you a little tidbit, guys. There's certainly a lot more to talk about in this.
Right.
But I hope it sparked your interest. Send in your questions. We're always glad to answer them for you. And Susie's going to leave us with a quote with only one S in it.
Yay! Thanks, Joan.
I always want you to look good, Sue.
I know you do. So with the rainy day happening, Joan picked this quote out, and I love it. It says, "Wherever you go, no matter what the weather, always bring your own sunshine."
Absolutely, by Anthony J. D'Angelo. Have a great one, everyone.
Bye, everybody. Stay dry.